back. It is World Breastfeeding Week, a global initiative aimed at raising awareness and support for breastfeeding. Here in Connecticut, St. Francis Hospital is taking part in those efforts. Joining us right now to talk about that is Mary Carnemolla. She is a registered nurse and prepared childbirth coordinator at St. Francis Hospital. Thanks so much for being with us, Mary.
Thank you for having me.
Now, the goal is to raise awareness, educate. What specifically are we focusing on this year?
So this year's theme is Step Up for Breastfeeding Support and Education. So it's a call to action for everybody in the community to really provide education and support for all of our breastfeeding families in the community.
And for moms who are new moms, what are some things that they need to know and they need to be aware of?
So definitely the benefits of breastfeeding, why it is so important both for their babies and for themselves, knowing that it is the biological way to feed our babies, and that the more education and the more knowledge you can get before you deliver that baby, the better, because we think that breastfeeding is natural, so every baby and every mom, it's going to come easy. But unfortunately, a lot of people do face some challenges, and it's important to build that support system and that knowledge base so that you can really meet your feeding goals.
Yeah, I'm a mom of 4, and I've been there, and a lot of times new moms, you see the pictures of moms nursing their babies, and you just think it's this a magical thing that just instantly happens. But there's a lot of struggles, and moms need to be aware that there are challenges, and that is normal, but there's help out there.
Absolutely, and at St. Francis Hospital and Medical Center, we really did go that extra mile to provide comprehensive breastfeeding support. So we work with outside programs such as Breastfeeding Heritage and Pride. It's a peer counselor program that will educate moms prenatally and then follows them for a year postpartum. They go into their homes, they do texting, phone calls, and then we just recently partnered with the Nest Collaborative, which is a virtual lactation service. Again, they provide prenatal education, but they also will do a comprehensive breastfeeding risk assessment in the prenatal period to set those moms up with a plan so they know what to expect after they deliver. And then they will, again, follow them for a year postpartum doing virtual visits. And then in-house, we have all of our nurses that are trained in lactation support, and then our international board certified lactation consultants that can handle some of the more comprehensive breastfeeding issues that may arise.
Now, most moms start to breastfeed and maybe they think that they're going to do it for 3 months or 6 months. But talk a little bit about the American Academy of Pediatrics. Now they are suggesting that moms and babies continue their breastfeeding journey till 2 years old, and that is significant.
Absolutely. So they have now aligned with what the World Health Organization has been saying for years.
Right.
So it's exclusive breastfeeding for 6 months, and then for 6 months up to 2 years, you would continue breastfeeding for as long as desirable by our breastfeeding couplet while introducing those solid foods.
But the numbers of moms and babies who are able to do that into 2 years old are not good. They're not where the AAP is hoping.
Correct, absolutely. And that's why hospitals such as St. Francis Hospital is really trying to break down those barriers to being able to meet those goals. So by providing services such as the Breastfeeding Heritage and Pride and the Nest Collaborative, as well as our in-house, we're getting rid of the transportation barrier because they're coming to you instead of you having to come to them. We're breaking down the language barrier because both programs offer multilingual IBCLCs to be able to help those moms out. And then we're breaking down the cost barrier, which is huge for most people. They can't afford to go to outside lactation help when they hit those struggles. So both programs, if you're delivering at a St. Francis Hospital or any hospital within Trinity Health of New England, we provide those services at no out-of-pocket cost to our families.
Now, real quick before we go, I think it's also important to talk about the social barriers with breastfeeding because the U.S. is far behind other countries when it comes to breastfeeding acceptance.
Absolutely. It's so important, and that's what this theme this year is about, Step It Up for Breastfeeding Education and Support, is to normalize breastfeeding.
That's so important.
Absolutely, and to make everybody comfortable in any environment that they're in to be able to feed their babies. That's how we were meant to feed our babies.
Absolutely. A lot of important information and a lot of resources that are available that our viewers just got information on. Thank you, Mary.
Thank you so much for having me.